If you're over 70, your doctor may insist these three medical tests are mandatory. But new research shows they could quietly harm your health instead of protecting it. Every year, millions of seniors take these tests, believing they're saving their lives. Yet studies now show many would have lived longer and healthier without them. According to physicians with decades of experience in geriatric medicine, it's time to question routine testing after 70 and focus on what truly keeps you well. Hello, everyone, and welcome. This message comes from years of experience caring for older adults and from watching far too many healthy people suffer because of procedures they never really needed. If you're over 70 or if you love someone who is what I'm about to share, could change the way you think about medical care in later life. You see, most doctors are trained to believe that more testing means better care. But after decades in internal and geriatric medicine, I've learned that once we pass 70, the rules change. The body changes. The balance between risk and benefit shifts dramatically. And sometimes what used to be a smart test in your 50s can become dangerous in your 70s. I've seen seniors who walked into my office strong, active, and symptom-free, yet after a routine screening, they ended up hospitalized with serious complications. Not because they were sick, but because the test itself created harm. So today, we'll look at three tests that are often called mandatory after age 70, but that major medical organizations now quietly warn against for healthy seniors. By the end, you'll understand exactly why these tests may not be worth the risk and what to focus on instead to protect your health naturally and safely. The truth about over-testing. Screening tests were originally designed for younger, healthier populations, people in their 40s, 50s, and early 60s, where early detection makes a real difference. But after 70, that equation flips. Your metabolism slows down. Many cancers grow more slowly, taking years or even decades to become dangerous, and your body's ability to tolerate anesthesia, dehydration, or invasive procedures decreases. That means the risk of testing often outweighs the benefit. Unfortunately, many doctors still follow the same checklist for everyone, regardless of age, health, or symptoms. The result? Seniors are often overtested, overdiagnosed, and overtreated. It's not that doctors want to cause harm, most genuinely want to help, but the system rewards testing, not wisdom. So let's talk about the three tests most commonly pushed as mandatory for people over 70 and why you may want to think twice before agreeing to them. Test number 1, colonoscopy. After 75, when routine becomes risky, for decades, colonoscopy has been praised as a life-saving procedure, and for adults between 50 and 70, it often is. But for healthy seniors beyond 75, the medical evidence tells a different story. If you've had previous normal results, continuing routine colonoscopies may bring little benefit and significant risk. Let's start with the numbers. After age 70, the risk of serious complications rises sharply. Bowel perforation, a tear in the colon wall, happens in about 1 in every 300 procedures for older adults, compared to 1 in 1,000 in younger people. That tear can cause infection, internal bleeding, and may require emergency surgery. Then there's the bowel prep, the strong laxative used to clean your intestines. For seniors, this preparation can cause dehydration, loss of electrolytes, low blood pressure, dizziness, and even heart rhythm problems. The sedation used during the procedure also increases the risk of heart or lung complications. In short, what used to be a simple screening at 55 can become a dangerous challenge at 75. A major study published in the Journal of the American Medical Association followed over 50,000 seniors above 75 for 10 years. The results were striking. Continuing routine colonoscopies did not reduce deaths from colon cancer, but it did increase hospitalizations from complications. Why? Because colon cancer is slow growing. If your last colonoscopy at 65 was clear, it would take 10 to 15 years for a new polyp to become cancerous. That means, statistically, you're far more likely to experience complications from the test than to die from colon cancer. So what should you do? If you have symptoms, rectal bleeding, unexplained weight loss, or sudden changes in bowel habits, diagnostic colonoscopy is appropriate. But for healthy, symptom-free adults over 75, it's often safer to focus on prevention through diet and lifestyle. Eat fiber-rich foods, stay hydrated, keep your body active, and monitor changes with your doctor instead of rushing into another scope. Remember, medicine is not one size fits all. The same test that protects a 50-year-old can harm a 75-year-old, and knowing when to stop testing is just as important as knowing when to start. Test number 2, PSA screening, the silent trap for older men. Next, let's talk about prostate cancer screening, specifically the PSA test. PSA stands for prostate-specific antigen, a protein that rises when there's inflammation or cancer in the prostate. For men in their 50s and 60s, this test can sometimes help detect aggressive cancers early. But after 70, research consistently shows that routine PSA screening does more harm than good. Here's why. By the time most men reach 70, small, harmless prostate cancers are extremely common. Autopsy studies show that up to 70% of men over 70 have prostate cancer cells, but nearly all of them would have lived their whole lives without ever knowing it. The cancer grows so slowly that it never causes symptoms or shortens lifespan. But when a PSA test comes back elevated, fear sets in and the cascade begins. First comes a biopsy. That biopsy can cause bleeding, infection, or hospitalization in up to 3% of older men. If cancer is found, which it often will be, because tiny cancers are common, you're suddenly facing pressure to choose between surgery or radiation, and that's where the real suffering begins. Many men who are completely healthy end up dealing with lifelong side effects: urinary incontinence, erectile dysfunction, fatigue, and emotional distress. They treat a cancer that would never have threatened them and lose quality of life in the process. A massive European study of 162,000 men found that PSA screening did not reduce deaths from prostate cancer in men over 70. What it did increase was anxiety, overdiagnosis, and overtreatment. That's why major organizations, including the American Cancer Society, the U.S. Preventive Services Task Force, and the American Urological Association, now advise against routine PSA screening after 70 unless symptoms are present or there's a strong family history. Let's be clear, if you're having symptoms, difficulty urinating, blood in the urine, or unexplained pain, that's different. You should see your doctor. But if you feel well and your only reason for testing is routine, then you may be risking your peace of mind and your well-being for little to no benefit. As doctors often say, most men die with prostate cancer, not from it. The key is learning to live well, not to fear what might never happen. Test number 3, heart stress testing. After 70, the dangerous chain reaction, 12 o'clock to 15:30. The third test is one of the most misleading of all, because it sounds so logical. Your doctor says, let's check your heart just to be safe. No symptoms, no chest pain, no shortness of breath. You feel fine. So it seems harmless, even smart to agree. But here's what many people don't realize. Heart stress testing in healthy seniors often sets off a chain reaction that can lead to serious complications even in those with perfectly normal hearts. A stress test pushes your heart to its maximum effort while monitoring its electrical signals. That might sound simple, but in older adults, the test itself can be risky. It can trigger arrhythmias or even mild heart attacks during testing, especially in those with underlying heart conditions. Even if the test goes smoothly, false positives are extremely common. Studies show that 40 to 50% of stress tests in people over 70 show abnormal results that later turn out to be harmless. And once that abnormal result appears, the medical cascade begins. You're referred for a cardiac catheterization, a procedure where a tube is threaded through your arteries to look for blockages. If they find even a mild narrowing, say 40%, it often leads to stent placement. Now you're on blood thinners for life, with higher risks of internal bleeding or falls. And here's the most shocking part. A study in JAMA Cardiology found that seniors without cardiac symptoms who underwent routine stress testing had no improvement in survival or heart outcomes compared to those who skipped the test but experienced significantly more complications. The truth is simple. If you have chest pain, shortness of breath, or unusual fatigue, a stress test can be valuable for diagnosis. But for healthy, symptom-free seniors, it often causes more problems than it prevents. The best heart checkup at this stage of life doesn't come from machines, it comes from movement, balance, and lifestyle. Daily walking, strength exercises, fresh air, social connection, and proper nutrition are the real tools that keep your heart strong. Medicine can save lives when used wisely, but when used automatically, without considering age and context, it can create harm where none existed. The story. Two different paths. Let me share a story that has stayed with me for years. Two of my patients, let's call them Helen and Robert, were both in their mid-70s when I first met them. They were healthy, active, and full of life. Helen's previous doctor had scheduled her for a colonoscopy, PSA testing for her husband, and a heart stress test. She felt fine, but she followed instructions because she believed it was mandatory. Robert, on the other hand, decided to learn more before proceeding. He wanted to understand what each test could truly offer at his age and what risks came with them. After reviewing the evidence together, Robert chose to focus on what he could control. He and his wife began daily walks, practiced light resistance training, ate a Mediterranean-style diet rich in plants and healthy fats, and stayed socially active. They focused on living, not testing. 5 years later, Robert was thriving, still traveling, gardening, and mentoring his grandchildren. Helen, sadly, had a different path. Her colonoscopy led to complications from dehydration and sedation. She was hospitalized for several weeks and never fully regained her strength. Stories like this are not rare. Over the years, I've seen countless healthy seniors harmed, not by disease, but by unnecessary procedures they were told were routine. That's why being informed and asking the right questions is the most powerful form of preventive medicine there is. 4 essential questions to ask your doctor before agreeing to any test after 70. Take a moment and ask these 4 questions. Question 1. Given my age and current health, what are the actual chances this test will find something dangerous in time to save or extend my life? Question 2. What are the real risks of the test itself, and what complications could follow from additional procedures? Question 3. If the result comes back abnormal, what would we do differently, and would it truly improve my quality of life? Question 4. What do the latest guidelines from major medical organizations recommend for someone my age and health level? If your doctor cannot answer these clearly or seems uncertain, that's your signal to pause and seek a second opinion. Remember, informed decisions are safer decisions. The new definition of preventive care. Here's the truth most people don't hear in a medical office. Healthy aging is not about chasing every test, scan, or procedure. It's about understanding when enough is enough and focusing on what truly keeps your body strong and your mind calm. After 70, less can truly be more. Fewer unnecessary tests often mean fewer risks, fewer medications, fewer hospital visits, and more time spent living your best life. So what should you do instead? Focus your care on proven life-enhancing habits. Move your body every day. Eat colorful whole foods. Keep your mind active and curious. Stay socially connected. And treat each new morning as a gift, not a medical checklist. Your body has carried you through decades of living, and it deserves gentle, thoughtful care, not aggressive interventions that may cause harm. If this message resonates with you, please share it with your parents, your spouse, or someone you love who's over 70. You might save them from an unnecessary procedure or even from losing the independence they value most. And if you want more educational and inspiring videos on how to live stronger, wiser, and healthier after 50, subscribe to this channel, Elders Living Better. Because here we believe that growing older can still mean growing better in health, wisdom, and happiness. Thank you for watching. Take care of your health, protect your peace, and keep living with purpose.